Handling dental emergencies, first aid tips for common issues. A dental emergency could be an incredibly painful and scary encounter. If you break a tooth, loosen filling, or suffer extreme tooth pain, it's crucial to be prepared for the situation until you are able to visit an experienced dentist. This video will talk about typical dental emergencies and offer the first aid tips to deal with these situations. 1. Chipped or broken tooth. If you break or chip teeth, you need to keep any damaged fragments and wash your mouth thoroughly with warm water. If you notice bleeding, then apply pressure using gauze or a dry cloth until the bleeding stops. It is also possible to apply cold compresses to the exterior of your mouth in order to lessen swelling. Consult a dentist as quickly as you can to avoid any further injury and infection. 2. Knocked out tooth. If your tooth is damaged, it's important to take action immediately. Keep the tooth in place in the crown, the portion that's usually seen in the mouth, and wash it off with water. Be careful not to get it in contact with the roots. If you can, put the tooth back into its socket and keep it there until you are able to visit an appointment with a dentist. If that's not possible, then store the tooth in saliva or milk to ensure it stays damp until you visit the dentist. 3. Toothache. The cause of toothaches is different issues like dental cavities, infection, and gum disease. If you are suffering from tooth pain, clean your mouth using hot water and floss to get rid of any food particles which could be causing pain. It is also possible to take over-the-counter medications to ease discomfort. It is important to consult a dentist in order to identify the root cause behind toothache and to receive appropriate treatment. 4. Lost filling or crown. If you have lost the crown or filling, it is essential to visit an experienced dentist as quickly as you can to avoid any further harm to your tooth. While you wait, you may make use of dental cement available at pharmacies to temporarily protect the tooth that is exposed. Do not chew on the part of your mouth in order to avoid further harm. 5. Abscessed tooth. A tooth abscess is an emergency dental situation that needs urgent attention. The signs could include extreme tooth discomfort, swelling, as well as fever and an unpleasant taste that can be detected within the mouth. If you think you may have an abscessed tooth, wash your mouth thoroughly with warm salt water and visit an experienced dentist right away. The use of antibiotics is often necessary in order to treat the tooth infection. 6. Broken jaw. If you think you may are suffering from a fractured jaw, you should seek medical attention right away. While you wait, you can apply a cold compress to minimize swelling, and then use pain medications if necessary. Do not move your jaw, and use gentle pressure to hold it in place. 7. Soft tissue injury. If you have injured the cheeks, lips, or tongue, wash your mouth thoroughly with warm salt water. Apply pressure using gauze or a dry cloth to stop the bleeding. If bleeding continues or the damage is serious, you should consult a doctor. Being aware of how to deal with dental emergencies will help ease discomfort and help prevent further harm to gums and teeth. Make sure to visit your dentist as quickly as you can for treatment as well as to avoid problems. If you follow these first aid guidelines, you will be able to better manage dental emergencies that are common and safeguard your dental health.